These tests are used to be able to test the strength difference between our TFL and our glute med, and also understand a little bit more about the hip biomechanics, which may be causing your clients pain. So when we're doing this test, there are two different ways that we are able to do this and put the information together to give us a nice picture. So the first test, what you'll get to do is get your client to extend their legs out so they're nice and straight out by their side. Their hips need to be aligned, knees stacked, and also ankles stacked as well. What you want to then instruct your client to do is to lift their top leg slightly off, and then once you actually get them to lift and hold there, is to rotate their foot outwards. So get them to lift up and then rotate their foot outwards. A positive test here is that when they rotate their foot outwards, their hip will drop backwards. This is indicative that as they twist outwards, their TFL is contracting and their glute med is not contracting, which is allowing the bailout to occur posteriorly. So if the client has equal control of the glute med and the TFL, they'll be able to stabilize that movement really nicely. Their hips will stay stacked and there won't be any movement or posterior rock as they move their foot in that position. If your client's unable to perform this, or you want to do a little bit of a gentler type of test, is get them to bend their knees up in front of them. Yep, perfect in that position. Make sure their hips are stacked, knees are stacked, and ankles are stacked again. In this position, you want to come and find the AS-IS at the front and slightly come forward onto your TFL. Also want to come just backwards from your TFL to be sitting on your glute med, so you have your fingers essentially on both the TFL and glute med during this to see which contracts. Then you want to instruct your client to keep their ankles together and just slightly open their knees as they come open. Yep, and then close back together. In this, what you need to do is actually pick up whether you are feeling a bulge or feeling the contraction under the TFL or the glute med. So you just get them to clamp open for you. As they're clamping open, what you should be able to feel is the TFL will slightly contract and then the glute med will be a stronger contraction to pull the hip in more of a locked posterior position. If all you can feel in this position is essentially the TFL constantly contracting and you never feel any bulge under the posterior portion of the glute, then it's likely the TFL is overactive, and this is a positive test for a hyperactive TFL and obviously a glute weakness in this position as well.